Welcome back, everybody, for another deep dive.
Always exciting to dive into these cases.
Today, we're dissecting two trauma scenarios
Oh, these are good ones.
straight from the pages of a paramedic textbook.
The ones they use to train.
Exactly.
So we're talking musculoskeletal trauma here.
That's right.
Broken bones, dislocations, the whole 9 yards.
We'll see how paramedics assess these situations.
See how they manage them in the field?
Make those critical decisions when time is of the essence.
Every second counts in trauma.
Okay, so first case, picture this.
Okay, I'm picturing.
It's a warm summer day on a farm in Ontario.
Beautiful.
Sun's shining, but inside the tractor cab, it's freezing.
What?
Yeah, the rider's been using it for horseback riding all winter.
Interesting detail.
Our patient, Laura, she's 50 years old.
Okay.
She's been knocked down by the tractor bucket.
Oh, no.
Now when the paramedics arrive, she's conscious and alert,
That's good.
airways clear, breathing's normal.
Okay, good signs.
Strong pulse in her wrist, they call that a radial pulse.
Yeah, radial pulse, that's a key one.
A bit of blood soaking through her jeans, but honestly, her vitals.
I was going to say, those vitals sound pretty good for a tractor bucket incident.
Right, I mean,
It's deceiving, though.
exactly.
Got to look deeper. It's like an iceberg.
Okay, so what's lurking beneath the surface?
Well, they discover she's got pain in both her upper legs,
Okay.
and digging into her medical history, she has osteoporosis.
Oh, that makes sense. Weaker bones.
Exactly. Increases the risk of fractures.
And she had her gallbladder removed 10 years ago.
Cholecystectomy, they call that.
Okay, now how does that play into this situation?
Well, it might not be directly related to the injuries,
Right.
but it could influence pain management options later on.
Oh, interesting. So many factors to consider.
Trauma is a puzzle.
So the paramedics immobilize her legs.
Standard procedure.
Seems pretty difficult in a cramped tractor cab.
You're right, not the ideal location.
So how do they go about it?
They would try to stabilize her legs as best they can,
Okay.
most likely with a traction splint.
A traction splint.
Yeah, you know, those things designed to stabilize femur fractures.
Oh, I've seen those. The ones that pull on the leg.
Exactly, helps align the bones.
So that's standard for this type of injury.
Well, there's actually some debate about traction splints.
Really?
Yeah, some studies suggest they might not always provide adequate stabilization, especially for certain types of femur fractures.
So choosing the right technique is crucial.
Absolutely crucial.
Now, after they stabilize Laura, her blood pressure and pulse increase.
The body's stress response kicking in.
Yeah, but what's the reason behind that?
Your body's suddenly dealing with injury and potential blood loss.
Even if you don't see a lot of blood.
Exactly, could be internal.
Okay.
So your heart rate increases to circulate blood faster.
To get that oxygen to where it's needed.
Right, and blood pressure rises to maintain blood flow.
To those vital organs.
Exactly, it's like overdrive.
Okay, so Laura's stable for now, but this next case,
Oh boy.
this is a whole different story.
Hit me with...
We're talking about Andre. He's 40 years old,
Okay.
and he's fallen from a drilling platform.
Oof, falls from heights, those are always scary.
And get this, he landed on a pile of his own clothing.
His own clothing.
Yeah, like, could that have actually cushioned his fall?
It's possible, but the height of that platform
Yeah, the height is the real factor.
and how he landed, that's key.
So when the paramedics get to Andre,
Okay.
he's conscious, but he's confused.
Uh-oh. Altered mental status.
That's not a good sign, right?
No, especially after a fall like that.
What does it suggest?
Could be a head injury, could be shock. It's a red flag.
And to make matters worse, he's got pain in his leg,
Okay.
his back, his arm,
Multiple areas.
and the paramedics can't find a pulse in his left wrist.
No radial pulse, that's bad news.
So what does that indicate?
Possible vascular compromise.
Meaning,
The blood flow to his hand is disrupted.
oh no.
Could be a fracture or dislocation pressing on an artery.
So if there's no blood flow,
No oxygen getting to the tissues.
is that like when you have a kink in a garden hose?
Perfect analogy. That's exactly what's happening.
Wow, no wonder that's a serious situation.
And to add another layer of complexity,
Oh, there's more.
Andre's medical history, he's got non-insulin dependent diabetes.
Okay.
He's got sciatica and takes medication for hypertension.
Oh, wow. Okay, back up a second.
Yeah,
That cold tractor cab in the first case,
with Laura.
could that have played a role in her injuries?
You know, it's unlikely to have directly caused the fractures,
Okay.
but exposure to cold can make bones more brittle.
Especially with osteoporosis.
Exactly. Every detail matters in trauma.
I never realized how everything's so connected.
It all ties together.
So back to Andre with his diabetes.
Right.
How does that impact his care in this situation?
Well, you see, when your body goes through trauma,
Yeah.
it releases a bunch of hormones like adrenaline,
Okay.
cortisol, fight or flight.
Right.
Those hormones can raise blood sugar levels.
And that's dangerous for someone with diabetes.
Absolutely. It's a serious complication.
Wow, I never considered that.
Adds another layer of complexity to his care.
So we've got Laura with her potential complications from osteoporosis.
Right.
Andre with his diabetes. A lot to juggle.
And speaking of Andre, his vitals show an elevated heart rate.
Okay.
Elevated breathing, too.
That's just a normal pain response, though, right?
It is, but it's also the body's way of saying, hey, something's wrong.
So those elevated vitals are telling them he's in pain.
And his body's working hard to cope with the stress.
So what are their immediate priorities for treating him?
Where do they even begin?
Yeah, I mean, it seems like a lot going on.
First and foremost, scene safety.
Oh,
Got to make sure they can work safely.
right.
And Andre's not in any immediate danger.
Makes sense. Scene safety first.
Then they'll prioritize stabilizing his spine.
Why the spine?
Any fall from that height, there's a risk of spinal injury.
Oh, right. And that could be devastating.
Exactly. Got to protect that spinal cord.
So after immobilizing his spine.
They'll focus on managing his pain
Okay.
and addressing that vascular compromise in his arm.
Getting that blood flow back.
Exactly. And of course, they'll be monitoring his vitals.
Especially his blood sugar levels.
Absolutely. Can't forget about the diabetes.
They're constantly assessing, reassessing, making adjustments on the fly.
It's a dynamic process.
And that brings up something you mentioned earlier about transport.
The transport decision.
Yeah, not every trauma case goes to the nearest hospital.
Right. Got to choose the right facility for the patient's needs.
So they're considering factors like severity of injuries.
The patient's medical history, capabilities of different hospitals.
Like Andre, with his potential spinal and vascular injuries.
He'd likely need to go to a trauma center.
A specialized facility.
Exactly, equipped to handle those complex cases.
Wow, so it's not just patching them up and rushing them to the ER.
No, it's about evaluating, anticipating complications.
Choosing the best course of action.
Giving the patient the best chance of recovery.
So we've got Laura with her factors, Andre with his multiple injuries and complex medical history.
Two very different cases.
It seems like every detail matters in these situations.
Every detail.
And the paramedics' knowledge, quick thinking, it can make all the difference.
It's a demanding job, that's for sure.
Well, we've covered a lot of ground already, but there's so much more to explore.
Oh yeah, just getting started.
Stay tuned for part 2 of our deep dive, where we'll take a closer look at those specific techniques and challenges involved in managing musculoskeletal trauma.
Looking forward to it.
So before we went away, we were talking about how paramedics decide where to transport their patients and how every decision is critical. But I'm curious about some of those specific techniques and challenges they face when managing musculoskeletal trauma, like you mentioned, spinal immobilization. How do they determine if that's necessary? It seems like a pretty standard procedure in most trauma cases.
Yeah, spinal immobilization, it's crucial, but it's not automatic. Paramedics consider several factors before making that call. The mechanism of injury, like a fall from a height like Andre or high-speed car accident, plays a big role. They'll also look at the patient's level of consciousness, any neurological symptoms like numbness or tingling, and of course the presence of pain or tenderness along the spine.
So it's a judgment call based on the specific situation. Better be safe than sorry when it comes to the spine. Right. Speaking of judgment calls, you mentioned vascular compromise in Andre's case. I understand that means blood flow is disrupted. But can you break that down in simpler terms for us?
Sure, think of it like a garden hose with a kink in it obstructing the water flow. That's essentially what's happening in Andre's arm. That absent pulse at his wrist suggests a blood vessel, likely an artery, is being compressed, possibly due to a fracture or dislocation.
I get it. So no blood flow means no oxygen getting to the tissues in his hand and forearm. What happens then?
Without adequate blood flow, those tissues can become ischemic, meaning they're deprived of oxygen. And if this isn't addressed quickly, it can lead to permanent damage, even tissue death.
That's pretty scary. Time is of the essence in that situation. What can the paramedics do to address vascular compromise in the field?
Well, they have a few tricks up their sleeve. Sometimes carefully manipulating the limb can restore blood flow. They might also apply traction to try and realign the bones, and pain medication can help relax muscle spasms that could be contributing to the compression.
So it's like they're constantly problem solving, trying to figure out what's going on and how to fix it all while working under immense pressure. It's a lot to juggle.
It certainly is. I remember one case similar to Andre's where the patient had a dislocated shoulder that was compressing a major artery. We tried everything we could think of to restore blood flow, but nothing seemed to work. We were racing against the clock knowing that every minute mattered.
Oh, wow. What happened?
We made the decision to try a procedure called in-field reduction, which basically means putting the shoulder back into place right there on scene. It's a risky maneuver, But in that situation, it was our best option.
Did it work?
It did. We were able to relocate the shoulder, and the pulse returned almost immediately. It was a huge relief, and it reinforced the importance of being adaptable and resourceful in those critical moments.
That's an incredible story. It highlights the quick thinking and decisive action that paramedics need to possess. It's not just about textbook knowledge, is it?
Absolutely not. It's about applying that knowledge in unpredictable situations, thinking outside the box, and sometimes taking calculated risks.
That makes sense.
Yeah.
Okay, so we've talked about spinal immobilization and vascular compromise. Now let's dive into pain management. I noticed both Laura and Andre were in significant pain, but they have very different medical histories. How do paramedics tailor pain relief for each individual's needs?
That's a crucial aspect of pre-hospital care. And it's not as simple as just giving everyone the same pain medication. Paramedics have to consider the patient's medical history, allergies, current medications, and the type and severity of their pain.
So it's not a one-size-fits-all approach.
Exactly.
Yeah.
They also need to consider potential drug interactions and any contraindications.
Contraindications, what does that mean?
It means situations where a particular medication might be harmful to the patient, for example, in Laura's case, with her history of osteoporosis and prior surgery. The paramedics might be cautious about using certain pain medications, especially opioids. Opioids, while effective for pain relief, can sometimes have side effects like respiratory depression and constipation, and these risks might be heightened in someone like Laura.
I see. So they have to weigh the benefits of pain relief against the potential risks.
Precisely, they might opt for non-opioid pain relievers or use a combination of medications to manage your pain effectively and safely. It's all about finding the right balance for each individual.
And what about Andre with his diabetes and hypertension? How do those factors play into the pain management equation?
Andre's diabetes can influence his body's response to pain medications, and his hypertension needs careful monitoring the patient. The paramedics would likely monitor his blood pressure closely and adjust his pain medication dosage accordingly. They might also consider using techniques like splinting and positioning to help manage his pain without relying solely on medication.
So it's a complex decision-making process, taking all these factors into account. It's like piecing together a puzzle, isn't it?
It is, and just when you think you've got the puzzle solved, a new piece might appear requiring you to reassess and adjust your approach. That's the nature of pre-hospital care. It's constantly evolving and demanding adaptability.
And that adaptability is what makes those paramedics incredible first responders. They're always on their toes, ready for anything you mentioned earlier about communication being key.
Yeah.
What kind of information do they relay to the hospital when they're transporting a patient?
Communication is absolutely essential, especially when handing off a patient to the hospital team. The paramedics provide a detailed report starting with the mechanism of injury. They describe what happened, how it happened, the forces involved. They'll also share their assessment findings, including vital signs, level of consciousness, and any obvious injuries.
So they're painting a picture for the receiving team.
Exactly. They'll also detail any treatments they have administered, the patient's response to those treatments, and any relevant medical history and current medications. It's a comprehensive overview of the patient's condition and the care they've received so far.
Wow, that's a lot of information to convey, especially when they're under pressure and probably exhausted from dealing with a traumatic situation.
You're right, it's a testament to their professionalism. And dedication, effective communication can mean the difference between a seamless transition of care and potential delays or misunderstandings that could impact the patient's outcome.
This deep dive has been so eye-opening. It's made me appreciate the complexity and challenges of pre-hospital care in a whole new way.
It's definitely a demanding and rewarding field. Every call is unique, and the paramedics have to be prepared for anything they need. A wide range of skills from medical knowledge and technical expertise to critical thinking, problem solving, and effective communication.
And let's not forget, compassion. It takes a special kind of person to do what they do day in and day out. I'm feeling inspired by their dedication and resilience. Before we wrap up part 2, I want to leave our listener with this. Imagine yourself as the paramedic arriving on scene for Laura or Andre. What questions would be going through your mind? What assessments would you prioritize? And how would you balance the need for speed with the importance of accuracy while ensuring the patient's safety and well-being? It's worth thinking about as you continue exploring this fascinating field. Stay tuned for part 3 of our deep dive, where we'll explore some additional resources and insights that can help you solidify your understanding of this crucial topic. So we've really got a sense of what it's like to be a paramedic facing those split-second decisions and the challenges of providing care in the field. But I'm eager to learn more what resources are out there for someone who wants to delve deeper into emergency medicine and trauma care?
Oh, there's a ton of information out there, both online and offline.
Okay.
A great place to start is the American College of Surgeons website. They have a whole section dedicated to trauma care guidelines, best practices, tons of educational materials.
Perfect. I'll check
Wow.
that out. I'm a podcast junkie, and I bet there's some amazing podcasts out there focusing on emergency medicine,
You are absolutely right.
so I can get my fix.
There are tons of podcasts hosted by paramedics, physicians, nurses.
Wow.
They share real-life experiences, insights from the field, discuss the latest advancements in trauma care.
That's awesome. I'll have to add those to my listening list. As we've been dissecting these cases, I've been thinking about something we haven't touched on directly, the psychological impact of trauma,
Oh, yeah.
both on the patient and the first responders. It's not just about fixing broken bones.
You're right. You hit on a crucial aspect of trauma care.
Yeah.
The emotional and psychological effects can be just as profound and long-lasting as the physical injuries.
Exactly. It's easy to get caught up in the medical procedures and forget there's a human being at the center of it all experiencing fear, pain, and possibly even trauma from the event itself.
Absolutely. And paramedics are trained to address not only the physical injuries, but also to provide emotional support, recognize that trauma can have a significant impact.
Like even just talking to the patient.
Exactly. They might need to calm a frightened patient, reassure worried family members, or even deal with bystanders who are distressed by the situation.
Yeah, it's a very human element that we don't always think about.
Yeah.
And what about the paramedics themselves? They're exposed to these traumatic situations regularly. How do they cope with the emotional burden of their job?
It's an important consideration. Paramedics and other first responders, they often witness suffering death, the aftermath of violence.
Yeah, it's heavy stuff.
They see things that most people will never experience, and that can take a toll.
I can imagine it must be incredibly challenging to process those experiences and still be able to show up and do the job day after day.
It is, and that's why it's crucial they have access to support systems both within their organizations and in their personal lives. Debriefing sessions, counseling services, and peer support groups can be invaluable for helping them cope with that stress.
It's a good reminder that these first responders, they're human beings too, and they deserve our support and recognition for the incredibly difficult work they do.
Absolutely well said. Trauma care. It's a complex and ever-evolving field. As we wrap up this deep dive, remember, keep asking questions, stay curious, and never underestimate the power of knowledge and compassion.
Beautifully put. A huge thank you to you for guiding us through these cases and sharing your insights. And to our listener, thank you for joining us on this deep dive into the world of pre-hospital trauma care. We hope you gained a new appreciation for the challenges and rewards of this vital field. Until next time, stay safe, stay curious, and keep learning.